Manitoba's COVID-19 modeling data was put under the microscope in court today. It was part of a legal challenge of the province's pandemic restrictions, put forth by 7 churches and 3 people. Early in the case, the church's expert witness, an anti-lockdown Stanford professor, said models are often incorrect due to flawed data. Today, the group's lawyer Alison Pahovich pointed to a November 10th model based on 124 ICU beds. By early December, the province said their ICU capacity was 173. The model also showed over 1,100 clinical beds, which were about 72% occupied. It suggested COVID patients themselves would max out the system in a month's time. By early December, the province said they had over 3,000 clinical beds. Pahovich used this to suggest the projected rise in infections would not have overwhelmed the hospital system with the increase in capacity. The province's lead epidemiologist argued the model helped spark the changes needed to increase capacity in the system. Dr. Carla Lepke said capacity is not a static number, and the system was at its limit. On Wednesday, Chief Nursing Officer Lynette Siragusa told the court hospital staff were exhausted when they saw 129 ICU patients at a time that equipment and space could have accommodated 173. Now, this constitutional challenge unfolding here as hundreds of doctors call on the government to enact stricter restrictions as they see sharp increases in ICU admissions. The province also added its largest daily total of new cases since mid-December. In Winnipeg, Stephanie Lasuc, City News.